For this question, I will start with CBD and type 1 diabetes because it's complicated enough with just that molecule. I'm Lex Pelger. I do canna education for CBD Sciences, the makers of Plus CBD, who has excellent CBD and THC products. On the cannabinoids, ask me anything. Today we're focusing on type 1 diabetes, which is the autoimmune disorder where the body's attacking its own beta cells that produce insulin. This is the one that usually comes out in kids and that you need to take insulin for the rest of your life, even though it is only about 5% of all diagnosed diabetes. Type 2 diabetes is the one that used to be known as adult onset diabetes. And usually the body is producing enough insulin, but the cells are resistant to responding to that insulin. It often comes about as a result of obesity or something like that. And it's generally first treated by lifestyle changes like diet and exercise, and then eventually by medications, maybe insulin. Here are some of the symptoms of type 1 diabetes, and we already know that the cannabinoids and CBD are helpful for some of these things, like improved wound healing, helping with fatigue, or balancing your metabolism. Here is the review paper we'll be leaning on today, and is available freely online. As these researchers point out, there's mouse models of diabetes type 1 where CBD decreases the incidence of diabetes, it lowers the inflammation of the pancreas, as well as lowering the destruction of those insulin-producing beta cells. CBD can shift the mouse from type 1 diabetes immune response to a type 2 diabetes immune response, which means less pro-inflammatory cytokines. Also, in related mouse models of obesity, CBD reduced weight gain and increased energy expenditure. Finally, when you have fat cells and you treat them with CBD, they have higher glucose uptake, they have reduced fat accumulation, and they are better at reversing insulin resistance. Diabetes has over 100 complications. One of the main problems is damage to the vascular wall. This leads to hardened arteries and an increased risk of heart attacks and stroke, plus damage to all of the micro blood vessels. Plus increased inflammation across the entire body due to an overactive immune system. For the heart and blood vessel system, CBD can help via the lowering of inflammation and oxidative stress, and it also activates several pathways, including those related to the lowering of scar tissue formation. CBD can even help lower cardiac arrhythmias, which is the incorrect rhythm of the heart. For the diabetic neuropathy, or nerve pain, this can include spontaneous tingling, stabbing or burning sensations, overactivation of the pain system in general, loss of sensation, and eventually foot ulceration and potentially amputation. CBD can help with this via the lowering activation of spinal white blood cells, as well as activation of one of the serotonin receptors that helps with pain. For damage to the eyes caused by these blood flow problems, CBD can help via blocking some of the glutamate receptors, the primary excitatory neurotransmitter, as well as by lowering inflammation and protecting the blood-retinal barrier. For damage to the kidneys, CBD lowers the infiltration of inflammatory cells, but some mouse studies show CBD making things worse. But the two existing clinical studies on this in humans show the CBD not causing any negative side effects. By the way, that's one thing I should stress. Almost everything I'm talking about here has been done in animal models. There's almost nothing done in type 1 diabetes with humans. There's a little bit done in type 2 or gestational diabetes, but this is an area ripe for exploration. And finally, for the brain injuries. Besides lowering inflammation and oxidative stress, CBD also activates the TRPV1 vanilloid receptors, as well as the PPAR receptors that alter genetic transcription. Though it should be stressed that none of these studies were in animal models of diabetes, but in other related brain problems. But if we know anything about CBD, it is that it is neuroprotective. Lastly, for strokes, the risk of stroke increases 3% every year that someone has diabetes. And you have a good number of preclinical studies showing that CBD helps to lower the area with disrupted blood flow, lower the neurological deficits, and decrease the permeability of the blood-brain barrier. Some studies have shown CBD contributing to an overall long-term functional recovery from stroke. So this is a very long video. Probably only 3% of you are going to make it to the end. But if you want to know more, there is so much more. Go to CVResearch.info or ask me more questions, and I can keep diving into this very complicated subject.